All right, so I want to talk to you about how to use your forearms, because this is by far the best way to massage, in my opinion, right? Now, when I first got this massage from a person that was a fantastic massage therapist, she was using her forearms and elbows like I'd never felt before. And that to me was just like, okay, I got to learn how to use my forearms properly. Now, most people are afraid to use their forearms for a few factors, and I'm going to go through this, and I'm going to show you how I use my forearms, because I became really good at using my forearms for a few good reasons. One, like I mentioned, it feels amazing. Nothing else, because it's broad, you can put weight onto it, and it's really, really fantastic. It feels fantastic to do, but it feels incredible for your clients. And that's when I first felt this. This massage therapist, a friend of mine, she was fantastic, and she would just work those forearms, and she would just settle down and just settle in on those muscles and just stop and pause, and I'll go through this and just make it super slow, and I'll go through that as well, the speed, the tempo. And I'll show you, as I say, using my forearms. And so we're going to go through that. I'll show you that. But first of all, I want to show you how to use your forearms correctly. Because like I say, just like me, many of you will be watching this and you go, well, I'm just not good at it. I don't feel confident with it. So I'm going to give you the confidence to start using this, and it's going to save your thumbs, your wrists, your hands, everything. And your clients, as I say, are going to love it. And you're going to love doing it. Right. Okay. So let's just have a look at a little bit of the anatomy here, because this is really important. So if we just start with the forearms here. Now, same rules apply like I keep talking about throughout all of my videos and all of my courses. You're going to need to use your body weight and weight transference like you would with any other stroke, all right? So just like any others, you're not going to be using standing statically, and which a lot of people do, unfortunately, and they just wreck their shoulders. So same thing, just standing there like this, which I've been through. Don't do this. There shouldn't be movement through here. It is weight transference and body weight, right? Going forward, so there's virtually no movement in the shoulder and the elbows, right? So, saying that, so what you don't want to do is start swimming around like this, wrecking your shoulder, and the little supraspinatus tendon is going to get abducted, you're going to be abducting, and you're going to get a really bad shoulder very quickly. And this is another reason people won't do it, because it hurts their shoulder. Right, so what do we want to do? So basics for this, keep your shoulder about 45 degrees, all right? And keep it static, okay? Very little to no movement will happen at the shoulder joint, right? So your movement is coming through with your body, your weight transference, right? So if we're going to do that, doing like that. Now, if you drop it back like this, what you're going to do here, okay, so keep this out in front, right? If you drop it back, what's going to happen is you're going to put all the pressure on the shoulder joint. When you're coming through here, you're driving through this humerus bone. So you're driving through there. And even when you can come back, but you're settling your weight down and you're dragging it. But it's once again, you're pushing just like plowing, right? But if you come back through here, now you don't have the bone taking all that. Now it's all on your tendons here. So keep this forward in this position. Keep it relatively static, so not too much movement. That is your first thing you want to be doing. Right. So once we got that, we want to start talking about the different. So if we have this in this sort of karate chop position, this position will open up the ulnar bone here. So if you want to put more pressure, this is a good way to do it, because you can put the bone down and you can start working through that, which I'll show you, okay? So you've got that method there, all right, with your hand like this. And again, you don't want to have your hand tight like this, so you can just practice this. And again, I encourage you to practice this both arms, right? You don't want to just be dominant one arm, both arms, and just relax everything, because you don't want to have undue tension, you know, in your fist and your hands like this. As you're doing this, you want to have it relaxed, okay? So as you're doing it, so as little tension in unless the muscles that you're actually using, so hand can be nice and floppy as you go through, all right? So you want to think about that. So we've got to have forearm forward like this, hand nice and relaxed, and if we have this position, we're going to have the ulnar here. A couple of things you need to be aware of. If you've got the ulnar here, you're going to be bone, and if there's bone underneath here, so you've got to be careful, like shoulder blades, between the shoulder blades here, you're going to be careful you don't want to clunk on the bones, and I'll go through that as well. How do you avoid that? Well, if you've got a bony area that you're working, you have your hand down. Now your forearm flexors come into play, right? So here, now what we've got, the ulnar bone, which is great, as I say, you want to put more pressure onto the person. You've got a big guy, big woman, and you're working there, you want to put more pressure. Well, that bone is going to help you as you work through those muscles. You can get better depth, all right? Now, if you're a bit, again, this is a good start point. If you want to just have hand down, prone positions, or pronated, so you can do that. So you've only got your flexors, and we'll focus on this area, okay? So that third of your forearm here is a great position to start working. So focus your pressure into there as you go through. All right, so this is a very safe position with your hand pronated, face down, okay? So you got that, and of course we can even supinate, and we can go through like this. And I encourage you to practice, and you can play with these. As you get better at it, you can start pronating and supinating and start getting feedback from your clients. How does this feel as you go through? And you can really make it, and I always talk about this in my courses, make it a dance, right? It should be interesting and fascinating for you. Just make it a dance. If you're doing the same motions, no matter what massage you're doing, if you're cookie cutter doing the same thing every day, it's going to get boring for your regular clients. Like, oh, it's the same old massage. Keep it interesting for your clients, please. So they come in and for their weekly massage, but it's like, oh, they're starting, what's that? I've never felt that before, right? Keep it interesting for them. They're going to keep coming back. And also, it's interesting for you. So you're not just boring like factory process, doing the same strokes all day, every day. Right. Now, back to the forearms. So we've got all these, so play with those, all right? You can play with these different angles, these twists, these sorts of things as you go through. But just remember, what are our key points? Using our body weight and weight transference. So body weight, sink down, and you can use this position, use this position. I'll go through it with you so you can have a look. Minimum amount of movement in the shoulder, arm forward like this, and I'm going to show you how to do it, okay? Practice with both arms, and as I'm going to talk about later on, is slow it down. Why? Because now, don't use too much oil, by the way, because you shouldn't anyway, right? Because it just makes it too slippery and hard to control. So when you're doing your forearms, because you're using a big area, you want to just have not too much oil, as I say, but you also want to slow it down, really control it. Now, you will see me, and I'll go through this as well, but you can hold on to your forearm, especially if you're just starting up. You can hold on to this and work like this, so you can have either way, a holding hand like this. As you work through, this will give you better control. You can have your hand on your wrist like this, up in your forearm like this. If you're going to come through here like this, all right? Now, when we start talking about elbows, I'm really talking about forearms, but if you want to come, because you're kind of working your forearm stroke elbow as you start to come up, so the more you decrease this angle, okay, that's going to bring the elbow, your olecranon, more into play. So if you want to, let's just say you're going up between the shoulder blades, if you flatten this out, it's going to put less pressure on. If you want to get more intense, you can bring that up, and that is going to play, so that flatter, it's going to go this more, and the more you bring it up, we're going to start talking more into this position, aren't we? So then you can just sink down. So like I was saying to you before, go slow, slow, slow. Think super slow-mo, all right? Because it feels amazing. I'll talk about tempo later on, but I was worried that going too slow would be boring until I felt the same massage therapist. She would slow it down and just sink down into those tissues, and she'd just hold there. And it just felt so amazing. A bit like, when you do thumbs like that, you go, oh, that feels fantastic. Same thing with the forearms and the elbows. Sink down, sink your weight, hold. And I've said this before in other videos, but let's just say between the shoulder blades here, you've got this amount, make it take 30 seconds, all right? And get your feedback from the person you're practicing with. They will love it. If you've got your pressure right, they'll go, you cannot go too slowly, all right? I actually think it'd be boring. No, it's completely the opposite. It feels unbelievable. These muscles just release, release, release. So slow it down, slow it down. Lean your body weight onto them, and you'll see me, and I'll talk about this. I'll put my hand at times, if I'm doing just one forearm, put my hand on the table, lean on the table, make it easy for yourself, right? You don't have to be, you can put your hand on the table like that and just lean down. I used to think it's, if they see that, that's laziness. No, it's not. You're looking after yourself and it still feels incredible for the person. So you can put your hand on the table there and just lean onto them and just work as you work, taking your time. Okay, so now I'm going to show you how I do this. So I'm going to show you about the back, the lower back, and we're also going to show you how I do the buttocks with the person fully clothed. So I'm going to start doing some Thai techniques to work that, and pressure point techniques and trigger point techniques and all that good stuff. All right, so I'll show you how to do this. Okay, so as promised, I'll show you how to use your forearms here. All right, now this first one is from about nearly 10 years old, but it's the same, I'm still using the same techniques. Now, a couple of things to take notice of. My left arm is already leaning on the table, making it easy for myself. I'm using my body weight, and you'll see my arm is forward like I taught you about. And I'm just leaning and going slowly, sinking into those tissues. So those are those aspects I was telling you about is use your body weight. You see my lower back, I've still got the inward arch in my lower back. Good posture, in other words. Now, so you get a better look at this. You'll see my hand is pronated. So I'm down. So I've only got the forearm flexors working the back. If I have my arm up like this, what you'd find is now the ulna's in play and I'll be clunking across the spinous processes. So you get a good look there of my hand leaning on the table, making it easy for myself. So I've got a nice wide stance. Sinking my body weight, you can see there. And so you'll sink down, going right the way down. A lot of therapists start and finish at the levator scapulae, come right the way down. Sink your body down so you're getting right to the top of the upper trapezius muscles. And once again, you'll see here, just working across. I'll show you this later on in the video as we work across the infraspinatus teres muscles across the top of the shoulder blade. Now using the left arm. So as I said, very little to no movement in the shoulder. We're using body weight, weight transference like I talk about. As I say, this is a deep tissue massage video of mine. But I was using those techniques back then. So it just gives you, as you see the more recent ones coming up, you'll see I'm doing virtually exactly the same things. Got my hand leaning on the table. I just lean on my client, lean on the table. And you'll see here, now, you'll see I take my body weight to the side of the person's head. I sidestep their head so I can go further down the back. Go as far as you can. Now, if you've got a particularly large person, go as far as you can comfortably. It doesn't matter, you're going to get it from when you're side on, but don't try and overstretch. But the difference is a lot of therapists may stay at the top of the head there and not make their way around to the side, which will give you, 10 inches or so further down the back by going to the side. Okay, now what I want to show you this is, apart from the forearms, this is what I call a distraction technique. You'll see me do this hand over hand, right? And then what I do this several times, and then I'll lead. If I'm going to do right forearm, I'll lead with my left hand. Look, left hand is going to come, you'll see it, and the forearm sneaks in behind it. So I keep leading with the left hand. The client's unaware of that, and then suddenly, where did this forearm come from? It's just a beautiful transition. It's like suddenly there's forearms. It's like a completely different feel for the client. This beautiful big broad stroke of the forearm. So I do this a lot. Transitions are really important. Whether you're transitioning, they shouldn't be just, suddenly we're doing scissor stroke and then we're doing, it should be like one motion in the whole massage there should be, the flow goes from transitioning from one stroke to another. It's not stop and then we're into a different one. So you can see here, just slowing it down, slowing it down. Of course, I don't need, to tell you that this feels absolutely heavenly for the client. Oh, and by the way, 10 years later, or 8 years later, whatever it is from the last video, I'm leaning on the table again. Again, you don't have to, but if you're not, you're using all your posterior muscles, your rectus spine, all these muscles are having to keep your body upright. Even with good posture, why wear yourself out when you can quite comfortably at times just lean on the table with your hand and still work. All right, so we're doing the hand technique again, distract, and see I'm holding the ankle, otherwise that lower leg would be wobbling all over the place. So we've got a nice, hold the ankle, and then we can do those lateral, the lateral head of the gastrocnemius. And you can also see I've got great center of gravity. I'm sinking down, so really wide stance. So my body is always getting nice control, sturdy base, as opposed to feet close together, leaning over. No, sink down. So now just, also apart from this being a distraction technique, as I call it, it all just breaks up. See how I bring that in? I lead with the forearm, I would lead with the hand, and the forearm comes in. Now I'm doing the medial gastroc. Look what I'm doing with the left hand. I'm keeping it in control, because if I just did the medial aspect of the calf would roll over, wouldn't it? If I came in, it would roll over. But I'm keeping that, so not only am I getting a bit of a squeeze technique between the hand and the forearm, but it keeps it in really good control. So as you can see here, it's such a slow, beautiful way to treat the calves. You can see that as we just work our way up there. Obviously, if you're going over the back of the knee, you're going to continue all the way up. You'd obviously just lighten off the pressure. You see I've got that ankle held there. Now see, we're just mixing it up. We do a hand over hand, and in comes the forearm. So you can see here, I'm now doing that medial aspect of the calf, and I've got my right hand to support it. Otherwise, the calf would it would tip over, wouldn't it? So I've got my pressure there. So that's just holding it all steady. So we get a bit of a toothpaste squeeze, if you like, as we go through. As I say, if I went up that medial side, the calf would just roll. Okay, now I'm going to show you doing the quadriceps. Now you know the quadriceps here, so you can see I just tuck that in around there, coming in that medial aspect, and you can see how I've got this supported, because if not, with the quadricep, it can wobble around very easily. So I'm going to just work medial, right, keep working my way medial to lateral, sort of central really. So vastus medialis, then come across rectus femoris. Now, tibialis anterior, the anterior shin. So once again, you see I just turn that, the lower leg, slightly rotate it medially, so it gives me really good access to go up that tibialis anterior, which is an often forgotten muscle, by the way, in massage. Now here's another technique for you to look at. So once you've done that work that I just showed you, you can bring this onto more of a stretch, lay it off. Yeah, of course you don't have to, but you can lay this off, and you'll see with my leg, my right leg, just putting it on more of a stretch as I slowly, so we start to challenge that muscle, just lengthen it a little bit as we work through there. So this is, again, think of your athletes, your people that go to the gym, I mean really anyone obviously, but you think your sports massage, your deep tissue massage, people that lack flexibility, you can really work this. Trigger points. It's a really nice way. You can see it's, once again, all very, very controlled, methodical way of treating people. Now, pressure point work. Okay, doing trigger points, pressure points. You can see once again, I'm holding the ankle. But you see, just work, this is from my trigger point courses. We're going to work these trigger points here through soleus, and the looks more like medial gastroc there. So again, what are you doing? You're using thumbs to hit these trigger points, or these tight bands of muscles. Not anymore. Use your forearms. Use them to your advantage. So you see, I'm just sinking my weight down there. Now, once again, we just come around to the more lateral side and we start working the soleus gastrocnemius as we go up the more lateral aspect. And again, I'm holding the ankle as we go. Keep it nice and stable. Okay, here we go. We're going to sit down, or sink down, and then come up through there. You can see that coming up between the shoulder blade and the spinous processes, or the C7 area. So once again, like I said to you before, very often practitioners will just start up at the levator scapulae or even above it. Get right down low and then come right up, right through as you come up and over. You don't want to forget those upper trapezius fibers. Once again, you can see like I was doing from 10 years ago, coming to the side of the head there. And like I said to you, if you can't reach that far even doing this, that's fine. Only go as far as is comfortable. Once again, you see my hand is down there, so we're not getting any bone or ulnus out of play there, just on the forearm flexors. So I'm just asking my son, is that pressure okay? Like you might want to do with your clients. As we come up there, so I'm now really working those forearm flexors there. Or working the muscle, really concentrating on those, as opposed to bringing the ulnar in. And just give himself a bit of extra support. So once again, you can see I was using my right forearm, now we're using left forearm. Get really good at both of them. I say, do a whole massage just with your forearms. You could make that a forearm massage, by the way. You could add a new treatment into your clinic. But once you get really comfortable, now, before I start that, see this, as we come up, you're going to come up to that shoulder blade. Just make sure when you're going to do this, lift up and over that medial aspect, that medial edge of your scapula. So don't drive through it because you're going to clunk right onto that bone. So come up and then you sink your weight down like I'm doing there. Okay? Now I'll show you again. So as I come down or come across, so you're just going to lift up and now I start sinking my weight down. So once I've got up and on top of that, now we start working infraspinatus, teres muscles, etc., etc. And of course, what are you doing? You're using your fingers and this sort of thing, thumbs, doing this. Forget it. This feels way better, as way more effective. Right, so the pectoral muscles. Again, you're probably using your fingers. Don't sit there in with your, well, you can, but move on to using your forearms right the way through the biceps. Now look, we're going to sink down and I'm just going to start working into and out of range with just lengthening the muscle as we go. Don't have to, you can just lay it flat. That's just another technique. As we work, so you can just, as we work through the bicep there, and we lengthen as it's really elongating those muscle fibers. Forearms now, forearm on forearm. Once again, you can see that forearms can take a ton of pressure. So working both the extensors here, then the flexors, feels absolutely fantastic. So again, as I go through this, I want you to start thinking about, what are you using? Are you using your thumbs, your fingers, your hands? You want to really start moving away from all of those. Now, I've got other videos where I show how to use your hands properly, how to use your fist properly. But if you're overusing them and not using your forearms, then you want to start transitioning into doing these, getting used to this, as I say to you. Because you'll never look back, and again, your clients are going to absolutely love this. It'll take your massage to a completely new level. And that's what I said to you earlier. When I felt this, I went, oh my God, I've from this massage therapist, now we're in the triceps here. But when I first, and you don't believe me, get someone that's really good with their forearms and get them to work on you and get feedback from when you're doing this. Once you've got it right, it feels so much better. So just slow it down, slow it down, slow it down. So you can just see that you're slowly working down through the triceps there. So as I said to you, don't be afraid, like I was, to make it as slow as possible. Yes, you can change it up like I do with the hand over hand, but then slow it back down, especially for your deeper strokes. When we start using forearms, it just feels so good. And again, get feedback from your client, from your person you're practicing with. So now we're going to start working the lower back. So think of your clients with lower back pain, lower back stiffness, or just including in your massage. You just start working these, and these will become your favorites. Just working your forearms through here. You see what I'll do? I'll just sink down, and then again, you're probably using your fingers or your thumbs to do these quadratus lumborum muscles. Not anymore. As what I'm doing here, it's a little bit hard to see, but I'm coming across there, and now I'm bringing that elbow into play as I bring it back laterally on the other side of the spine, and bring it to get that on, to connect onto that quadratus lumborum, as opposed to coming in with my fingers or doing it on this side to press in with my thumbs. I'm just working those. Now that's the trigger points at the bottom of the 12th rib, and just coming in, and I'm leaning into, if that's the quadratus lumborum, I'm coming into that and just leaning in like that, just bringing my weight towards me. Way better than using your fingers, way better to come this side and using your thumbs. Can you? Absolutely you can, but you don't want to be reliant on it. So once again, we're just going to continue doing lower back work here. Now we're going to go up. You can work all the way up the length of the back here. So you can see how slow I'm going there, getting a nice myofascial stretch there. You can even see where I've got the tissue just lipping up like that as I'm just putting a beautiful stretch through those. You can see the lower back muscle there is getting this lovely pull on there. So very little oil. Massage creams are great, as you want to get that nice myofascial stretch. Now, you can see that beautiful control. I'm just going to work into these deep tissue muscles, these deeper muscles in the lower back here, in those trigger points just below the 12th rib. Now to come up. So you see I'm using hand in this position, getting the ulnar into there and into play. And now we're doing, remember I showed you this, what I had? Now what I'm doing is just going into this side of the quadratus lumborum. As opposed to using my thumbs, I'm just going in and leaning in with my ulnar like that. I say, you're going to really appreciate just the fact that you don't have to use your thumbs so much when you get really busy. And you start doing your forearms, people are going to love your massage, just like I did. It was like one of those moments like, oh my God, I have got to start using my forearms. This feels, I got to learn how to do this really well. All right, so now I'm going to finish with using your forearms and just some Thai massage techniques. This is from I was doing buttock and hip trigger point work, and using it by doing, because sometimes you're going to have clients that don't want to take off their underwear, so you'll be using through their clothing. So you want to know how to do this as well. So you can see that, hand on the table, I'm using my hand for support, and I'm doing rotations, I'm doing doing some supinations, rotations, and once again, I'm not doing this, I'm using my body, keeping that shoulder happy. Pressure point work, so you can see whether it's using oils or no oils, you get used to this. Keep practicing. and both arms, like I say. And you're going to be really fantastic at this, and it's going to be, as I say, it's just going to change the way you look at your massage, and it's going to change the way people feel your massage. Because if you've hardly used your forearms, you're very seldom using them, then they're going to feel the difference on this, and they're going to absolutely love it. So as you see, I'm just working there. So as we do that, so start practicing it, get feedback from whoever you're going to practice with, do the back. Just concentrate on using your forearms throughout the whole massage, okay? As a practice, as something to practice with, use it as an exercise and really get used to it. And as I say, it's just going to be, you're going to love doing it, and your clients are going to love receiving it.